Hi everybody, this is Dr. Sham. I am a rheumatologist. I practice here in Chennai. So, this is again the most important topic. So many times, for so many reasons, people think steroids and painkillers are the only treatment for rheumatoid arthritis, which is totally not true. That is the reason I have brought this topic. See, the most important thing whenever a patient comes, particularly patients who come with a very bad pain, sometimes they might even come in a wheelchair, is pain relief. Say, I can talk all theory throughout the day. That is different thing. At the end of the day, patient comes to a doctor for a suffering. The most important thing will be pain relief. Remember why always a physician or a rheumatologist prescription that initial couple of months or 3 months will have a painkiller or a steroid is the tablets for rheumatoid arthritis takes 3 months minimum for it to start acting. See, there are patients who come with mild pain. To them, I just explain, or there are sometimes where we won't be able to use a painkiller or steroid. Then also I tell them, explain. See, it takes time, so please understand. So you can wait for it. But there are times where the patient doesn't have risk factors. Nothing in rocking and taking 2 to 3 months of a pain reliever like a steroid or sometimes anti like a painkiller. So that is because one is to make the patient comfortable, then it also speeds up the process, means it will be easy for us to control the inflammation. Initially we give a pain reliever, control the inflammation. See, remember, both steroids and anti-inflammatory drug, it doesn't just controls the pain. There is active what we call inflammation. It's something like fire burning in the joints. So these steroids and painkillers also help in dousing the fire. It's not about just a pain control, it's about controlling the inflammation, because of which the pain gets controlled. So it's not just a symptomatic treatment. So once the main tablet, that is the tablet which is supposed to be given for rheumatoid arthritis, starts or taking over or starts acting, definitely we try to taper and stop these tablets. This always I at least tell to my patients. So remember, steroids and painkillers are only a temporary or intermittent measure. They are never the treatment for rheumatoid arthritis, or for that matter any inflammatory arthritis. Paracetamol, it's safer, but many times it may not help. Tramadol, again, these are other pain relievers. Again, it may not really help much in inflammatory arthritis. So remember, it's just a temporary measure. And usually we do tell our patients, if you are putting them on a pain reliever, so discuss with your rheumatologist, even if you have any apprehensions, and go accordingly. Always, any tablet we give, we always do it with monitoring. Without monitoring, we never give any tablet. Okay. So these are the different types of steroids. If somebody is already this one, you might have seen your doctor writing it. I just mentioned the brand name just because for people to be familiar with the types. So there are various type of steroids. It's not something is good over the other. Maybe some minor differences might be there, but generally, in general, all of them are steroids. In short term, steroids are pretty safe. Means for the initial 2 to 3 months, maybe there might be a little bit weight gain. I always tell my patients to exercise and also take care of the diet. That can be discussed with your doctor. Steroid never touches your kidney or any organ for that matter. So in long term, we have to be careful, particularly if it can affect the bone density. Some people can have some cataract, or it can fluctuate the sugars. So all these things will be discussed with the patient depending on their individual risk profile. So practical reasons, initial 2 3 months, most of the patients, unless they have risk factors, it's a safer option. As I told, the reason for that is for the main tablets to start acting. Then the other thing is something called injecting steroids into the joint. This is something, a lot of myths around, like some, if you inject into the joint, it is very dangerous, or it means you have to keep injecting it regularly. See, not at all. Taking steroid as a tablet acts throughout the body. It can have some harmful effects, but taking an intra-articular, means only into the joint, it's actually safer. There are literally or practically, of course, theoretical side effects are there, but practically in practice, we hardly see any side effect, because the drug is going to be injected not into the bone. Remember, that is, people think it might be very painful. We are going to inject it into the joint. Okay, so this is one of the safest procedure. This again, it may not be possible if you are going to inject into so many joints. So if one or two joints are going to be involved, there are some contraindication, like we can't give a painkiller, we can't give a steroid. In those patients we give it. Or we want our patients, means patient has a big knee swelling, we want the patient is coming in a wheelchair, then definitely taking out the fluid and giving an intra-articular steroid helps the patient. It's only a temporary measure. It might help for 3 to 4 months. Definitely it's not harmful, but it's not a permanent solution. And usually we don't keep injecting again and again. Usually not more than 3 injections is allowed in a year. Even that most of us don't do. We try to control the disease with a better drug like specific tablet for arthritis. So this is something, the main take home message, it is totally not true. Steroids and painkillers are not the treatment or main treatment for rheumatoid, or for that matter any inflammatory arthritis. So just winding up this one with the last slide, like just want to tell, see, many times we start like this. This is actually my prescription for one of my patients. We start a low dose steroid along with the main tablet. See, many times we tell this tablet takes time for acting, as I told before. This is the one which is going to relieve the pain. Sometimes what patients by mistake think is this tablet anyway is not doing anything. They will realize that even though they are going to take, it's not going to help with the pain. But once they take this, immediately they feel very happy. So sometimes we lose track of patients. They don't come for follow-up and they keep taking this painkiller like a steroid alone, that is the main reason many times steroids got the bad name. So please understand, this is only a temporary measure. The main tablet takes time. Please, if not, ask your doctor, ask which is the tablet which has to be taken on a longer run, which is the one which has to be stopped. Please discuss this. This commonly we see, because this gives the immediate relief. I'm not blaming the patients, but please discuss with your doctor, because in the end we do see some complications or side effects. So be careful about it. This immediate relief, the one which gives, is not the main tablet. The main tablet is one which is going to be silent for 3 months and then going to take over. So remember this point, which is very, very important in our daily practice. So that is not going to be a regular medicine. This is going to be a regular medication. Remember this. Thank you.